Thank you for joining us today, Dr. Trevor Lee. Dr. Trevor Lee is actually a recent USC graduate at the School of Pharmacy and is industry focused. So I want to give you a chance to introduce yourself. Thank you for joining us today.
No problem. Thanks for having me. My name is Trevor. As you said, I was born in Torrance, California. Went to undergrad at San Diego State University. I got my bachelor's in biology. Then went on to the USC School of Pharmacy, just graduated in May. Ended up getting a post-doctoral fellowship at Mannkind Corporation in Medical Affairs. And as of now, I actually just resigned a couple weeks ago, recently to take on a full-time position at another company. So I'm excited, looking forward to it, and glad to be here.
Wow, yeah, thank you for that introduction. I definitely want to dive into that a little bit, but before we do that, do you mind just like talking about what got you in the industry in the first place?
Yeah, definitely. So I think when I was in my first year of pharmacy school, I always thought residency, right? Because all I knew was retail. So it's like, do I really want to count pills and shadow and counsel patients? So I kind of thought residency all the way, but I did want to keep an open mind. And so actually early on in my first year, I got a job at UPC main campus at USC. Did that for about 7 months. Liked my experience, but it wasn't for me. So I actually went on to work at Providence, little company in the area in Torrance. It was geared toward residency. So they trained us to be a resident. So our fourth year, we got to do clinical shifts every weekend, dosing vancos and warfarin and all these antibiotics. Great experience as well, but it wasn't for me. And I wanted something that was more project-based, more individual work where I could, prioritize work and set my own deadlines. And so I thought to myself, what else is there out there? There's got to be something else out there that fits my personality too. So I decided to apply for an appy in the industry. And I'll get into my mindset later on how I pick my appies, but I ended up getting a appy rotation at Mannkind Corporation in clinical development. So I got 6 weeks there early on. Loved it, went in with open minds, worked my butt off, try to learn as much as possible to see if that was something for me. I really liked it and ended up getting a part-time position in medical affairs. So got to know the preceptor during my time in the appy. Worked for him. He really taught me the ins and outs of medical affairs and what we really are. Ended up applying for a fellowship and ended up getting it. And I think one thing that I learned all the way is that I didn't have experience and I was very discouraged to apply for fellowship. But I think one thing I want to give advice for pharmacy students is from Mark Cuban, who's the Dallas Mavericks owner, the basketball team, is all you got to do is hit one, right? All you got to do is hit one to be successful. You can fail as many times as you want, but if you treasure that one experience that you end up getting, it can lead to a world of opportunities. And so that's kind of my demeanor throughout pharmacy school.
Nice. Yeah, most definitely. I appreciate you throwing in the Mark Cuban quote. Big fan. But so like what you spoke about not having too much experience going into these fellowship interviews. What kind of sets you apart, or what do you think sets you apart and got you that position at Mannkind?
I think it's honestly the experience you get during your appies as well as your leadership experience at USC or your pharmacy school that you go to. Because at the end of the day, what they're looking for is somebody that's confident, that actually got meaningful experience. I don't think going into appies, you should think about it from a perspective of the biggest name as far as company wise. I think you should go into appies figuring out which company is going to give you the best hands-on experience moving forward. Because at the end of the day, when you're going through those fellowship interviews, they're going to ask you what you did and they can read you like a book. And so if you don't get that experience and you don't know what you're doing and what you're saying, then what's the purpose? And so that's kind of what I try to do in setting myself apart with fellowship interviews is, getting that hands-on experience, prepping for those interviews as much as possible and being able to relay that information as best as possible to those companies.
And so like moving forward towards like appies, were you strategic about picking these appies? I know you said your first industry experience was with the appy, right? So what was your mindset going into like picking your appies?
Yeah. So when I was picking my appies, I was lost. I really didn't want to do residency. I was kind of set on that, but I wanted to give industry a shot. So I talked to a lot of different people. I picked people's brains to figure out what was the best site that was going to give me the best experience, like I was alluding to earlier. What's going to give me the best hands-on experience, not just best company. So I talked to a lot of people, and they said that Mannkind was the company you want to go to, one of the companies, because they give you a ton of experience, and you'll be doing impactful work, and you'll be able to talk about that if you do apply for a fellowship. And so that was kind of my main focus, was going all in on Mannkind and kind of taking it from there and see what happens. And so it really was a blessing in disguise. And then from there it was more trying to figure out the best schedule as far as off blocks go, and when fellowship interviews started, and just making my schedule balanced so that I wasn't stressed at all times throughout my fourth year.
Cool. So I want to dive into the hot topic of the day. So recent fellow at Mannkind, and then you recently got offered a possible full-time position for an industry company. Do you want to talk a little bit about that? What was your mindset going into that, and things of that sort?
Yeah, so I think I would say I'm a go-getter. And so I think one thing that I realize is that we have a pandemic that we're still in to this current day, and I wanted to make sure I took a proactive approach to looking for jobs. So I used LinkedIn, I used various different sites to figure out what was out there, and just figuring out if there was anything that kind of triggered in my mind. And so I started applying in early December, late November. I used my network, try to reach out to people and see what they did, and what maybe if there was a job opening at their particular company. And so things just took off. I mean, I started applying. I think my first job that I ended up applying for, I ended up getting. So I think that's my biggest tip for fellows going forward, is at the end of the year, I think companies are trying to use their budget before the end of the year, because if they don't, they lose out on that money. And so that was kind of my strategy as well, is look early, be proactive, especially since this pandemic hit. A lot of companies took a detrimental hit as far as money goes. And so, this is the best time to apply. And if you're confident in your skill set, then why not? I mean, it doesn't hurt. And just, I think also what's really important is to not lose, connection with your fellowship director. So I always constantly kept them in communication with him, and making sure that he was okay with me applying for jobs early on, and just explaining my situation. And so I think that's really important too. Don't burn bridges, keep in communication with your fellowship director, and then go from there and see what's out there. Talk to as many mentors as possible while you're in your fellowship. Check in with them. They can give you a lot of great advice, and that's what I did. Was kept in touch with my mentors, and I asked them, "Is it normal for people to look for jobs this early, or is that not I guess frowned upon, or is it frowned upon, or is it like residency where you should finish?" And they said it's totally normal. If you feel like you're confident, then go for it. People get out of their fellowships in February, March, as long as you keep in communication with your fellowship director. It's totally fine, and just be transparent. So that's what I did, and it's a blessing in disguise that it all worked out. But I'm excited, and I feel like I can use my skill set that I learned at Mannkind and translate it and continue to build it. So that's the goal.
I'm really glad you said that, because I know, like, as pharmacy students, we hear time and time again, like, the world of pharmacy is so small,
Yep.
and burn any bridges. And I think there is that, like, a happy medium of being able to, like, prioritize your needs and also not burn any bridges. Thank you for sharing that. Really do appreciate you sharing that, because I know it's a lot more common than we hear about as students. Appreciate you being transparent with us. So I guess going back to like pharmacy school, or like if you could give your P1 self any advice, what would it be?
Yeah. So I would say do what you want. And I think that's the biggest thing that I've learned over the past couple of years is you go to a pharmacy school and they're known for industry, or they're known for residency. Specifically for USC, they're known for residency. And so I think a lot of people are followers. They say, oh, wow, like my friends are doing residency, or wow, my friends are doing fellowship. So why don't I go that direction and not keep an open mind? And so just don't fall into that trap. Be yourself, look for opportunities. Don't just, set your mind to community or residency, because at the end of the day, you're going to fall into a trap of being in your P3 year and realizing maybe it wasn't for you. And then you're wondering, how can I scramble to get a summer internship for fellowship after being all in on residency? And I've had multiple people that have reached out to me to talk and say, Trevor, I'm stressed because I wanted to do residency, and now I realize that's not for me. What do? I'm a P3. I'm going into Appies. And I said, look at my story. I mean, I was lost just like you, but don't give up. I mean, that's the last thing you want to do. You know, treasure opportunities, try to make the most of it, and you never know what can come, right? Again, as I said before, all you got to do is hit one. So I think that's my biggest advice. Don't fall into the trap. You know, take opportunities and treasure it and go for it.
Like you're still involved with like summer camp counseling, right? And that was like even throughout like the madness of pharmacy school. I wanted to ask like what kept you motivated to stay in that and doing these like outreach programs and things that you've been doing since you were younger.
Yeah, I love mentorship. I love, you know, helping out the community, and that's why I got involved with pharmacy, serving the underserved. And I think it just helps me clear my mind and really focus on what I need to focus on, because that's what, you know, gives me life at the end of the day. And so that's the reason why I'm involved in these, you know, summer internships, summer counseling positions, to just get my mind off of pharmacy and just, I guess it also brings me back to focus on what I need to do with my life. So that's the reason why I do that.
Yeah. So I guess I mean that was pretty much everything that I had for you. Is there any like last minute advice that you want to give to, you know, current industry seeking pharmacy students or anything like that?
Yeah, I think it's just kind of what I said before. It's just follow your passion, you know, work hard, don't go in with a closed mind, and then go from there. A lot of opportunities will open up from there, and just don't ever stop going to networking events, because those are huge. I mean, that's the reason why I got the job that I did. I mean, that was my opportunity that I kind of try to snatch onto and go from there. So just, yeah, just keep an open mind and keep moving forward, and see what happens from there.
Yeah, thank you so much. Keep an open mind, keep moving forward. Thank you for this message. I think, you know, pharmacy students P1 through P4 find some like real value in it. Again, thank you for joining us today, Dr. Trevor Lee. It's been an honor.